This is Dr. Robert Israel. I am an orthopedic surgeon specializing in sports medicine. I did my orthopedic training at the Hospital for Joint Diseases in New York City. I did a senior fellowship in sports medicine at the Hospital for Special Surgery, also in New York City. After I completed my basic orthopedic training, I did a fellowship in sports medicine for 10 months. 6 months I worked at the University of Oklahoma School of Medicine with the doctor that took care of the University of Oklahoma football team. And for 4 months I worked in New York City at Lenox Hill Hospital with the doctor that took care of the Jets. After I completed my fellowship, I was asked to return to the Hospital for Joint Disease in New York City and to run the sports medicine service. I did this for 3 years, and then I went into practice outside the hospital, still specializing in knee surgery and sports medicine.
Okay, great. Looking at this first photograph, can you tell me a little bit about what this patient came to you complaining about?
First photograph actually is a photograph of a normal knee as viewed through the arthroscope. The upper part of the photograph shows a small part of the femoral condyle. The lower part shows a image of the tibial condyle, and the semicircular area is a meniscus. This is a normal knee. In contrast, the second photograph shows a knee with a torn meniscus. Again, the upper half, the very white area, is the medial condyle. The lower part shows the meniscus, and in contrast to the earlier picture where you saw it was semicircular and smooth, you can see that it is torn, and the fragment is flipped up on itself and caught in between the femoral condyle and the meniscus. On the extreme left, when you're looking at it, you see synovium. That's the pink area that is part of the lining of the knee. And on the right, you can make out the lower surface of the knee, the tibia, with a smooth articular surface. The symptoms someone with this condition might have is the knee would be locked and stiff, and the person would experience something catching inside the knee, which you can imagine from just looking at the picture.
So what would your recommended therapy be for this patient?
The only treatment for this type of injury is arthroscopic surgery. Arthroscopic surgery is where you make some very small holes in the knee. They're usually 2 or 3 millimeters wide. One of the holes is for insertion of an arthroscope, which is a camera with magnification that's connected to a TV screen, and the other is for an instrument, and you would introduce the instrument into the knee, and the area that is flipped up on itself would be trimmed away and the remaining edges of the meniscus would be shaved and contoured so that nothing would get caught when you moved your knee.
Great. And then what can someone who has this arthroscopic surgery perform successfully, what can they expect to experience?
Well, immediately after surgery, you will have some pain, not very much. It'll feel a little stiff, and it may get swollen. In the course of rehabilitating the knee, which means regaining normal motion and normal strength, you can anticipate full resolution of any of the symptoms that you experienced beforehand, and you can anticipate a resumption of all activities, including very vigorous sports activities. This has been Dr. Robert Israel giving you some advice on sports medicine injuries. Please feel free to contact me should you require additional information.